Cindy Novak, Downsize Administrator with the Carolyn Stark Real Estate Team. Thank you so much for joining us for our Home Edition event. We're so excited today. We've got Dr. Dave Ferguson and Marggie Hatala. They're from IKOR Midwest. They have a lot of experience helping seniors navigate healthcare as they age. Today's program, Life Planning, so you're going to have elective surgery. Now what? Has a lot of great tips for you. So take it away, Dr. Dave and Marggie.
Well, good day. I want to thank Cindy for having us. I'm Dr. Dave Ferguson. I'm the owner and managing director of IKOR Lifecare Management. I'm a physician, and today I'm joined by Marggie Hatala, the nurse advocate of my team. If you want to say something, Marggie.
Yeah, I'm Marggie Hatala, and I do work as a nurse advocate and a life doula with Dr. Dave here with IKOR, and really love to advocate for clients.
Thanks, Marggie. And I got interested in this. I practiced for a number of years, and I saw the challenges that my mom in particular had, just kind of managing day-to-day things, going to doctor's appointments, medications, all those kind of challenges that can come up as you get older. And as I left my clinical practice, I saw a way to take my experience and help individuals navigate their way through what can be a very challenging time, especially with complex medical issues. And so we've just found really great, the kind of work we're doing now is just very gratifying in terms of helping people navigate their way through. And so I was invited to spend a little time today talking about stress management. That's one of the things we're interested in, helping caregivers and individuals who are facing some stressful situations. And so today what I wanted to do was to use a very practical thing that people face. Maybe you've already been through it, or you know someone who is facing a situation of heading into surgery and finding that very, very stressful. So I want to take some stress management tips and apply it to very practical situation that a lot of people face today. So again, I'm Dr. Dave and Marggie. I just wanted to kind of introduce this idea of the webinar series. We have a webinar series that we enjoy talking about health and wellness topics, and this is a part of that. And so we really are trying to take a very holistic approach to some of the issues that come up with aging, really looking at body, mind, and spirit, and how we can help people through what is a really tough time. So today's session is So You Need Surgery, Now What? And I think that's for a lot of people, the question is, are you ready? And for a lot of people, they may put it off, or they might pencil into their calendar and then just worry about it, just stress about it.
Exactly.
Oh,
absolutely. And sit home and worry about the date, and is it going to happen, and what will I do? Will I have to take time off work and all these things? But they're stagnant about it and not able to really know how to handle those things.
Right. So maybe they're in a situation where they're taking care of someone. So they're the primary caregiver, and they may tell themselves, well, how can I possibly do this? Who's going to take care of the person I'm taking care of as the primary caregiver? So they put it off, or they worry about it. And then the delays may actually exacerbate the problem, make it tougher ultimately. And so that kind of delay in care we see in caregivers. It's being a caregiver in a tough situation, like with a spouse or partner that has Alzheimer's or dementia, is an independent risk factor for having difficulties as a caregiver in terms of increased health problems, even mortality. So it's important for caregivers to take care of themselves. And so one of the things of taking care of themselves, if you're facing a surgery, what do you do in those situations? So again, some people, they put it on the calendar, they tell them, the scheduler calls and says, here's your date, and then now you have 4 to 6 weeks to just kind of worry about it as an elective procedure. And as the date comes closer. And so we work with the client and really helped them think about that in a different way. And so that's really what we want to talk about today, is to take a very practical problem that a lot of people face, and then apply some of these principles of life care planning to that. And again, ultimately, the goal is to avoid loss of independence, right? The things that are important to us as we get older, avoiding hospitalizations or prolonged hospitalizations, and then avoiding reduced quality of life and even premature death. And so these are all things that have been shown in some of the literature early on now, taking this kind of systematic approach to getting people ready for surgery has shown some benefits.
Absolutely. And to just a loss of independence, to be able to pre-plan for that and to take some measures to strengthen yourself and do different things is enormous. So.
Yeah, and so one of the toughest parts is oftentimes is making that decision. And so if perhaps you're in a situation where elective surgery has been recommended, and it could be an orthopedics procedure, or shoulder replacement, a knee replacement. It could be an elective abdominal surgery of some kind. It could be go through all the whole list, but your physician or your physician team have recommended a type of surgery that you have a little bit of time to prepare for. Making that decision itself, it might be easy. You're ready to go. Okay, good. Now you can start planning, right? Or maybe you tell yourself that I don't want to do that under any circumstances. But that doesn't mean the planning is over, because the consequences of not having surgery is something to think about as well. But when you're stuck in the middle, having that conversation with yourself, one day I want to do it, the next day I don't. 1 hour I want to do it, the next hour I don't. That can be really tough, and that's stressful, and it takes up energy. And getting to a decision either way is a stress reliever.
Yeah. And to empower people to do that, to help them to say that we can help you out, we can stand with you and educate and do things to allow you to be engaged in your care, which is really important.
And you might not even realize what that struggle with the decision, how it may be manifesting itself to those around you. Mm-hmm. And we've seen that recently, where irritability, frustration, loss of sleep, you may not even be aware of how that struggle is manifesting in your life. Snapping at somebody that you care about. I mean, there's all sorts of manifestations of that type of ambivalence, which is really what it is, that can come out that you may not even be aware of. So regardless of where you are in that conversation with yourself, helping to get to a decision is important, and in itself a stress reliever. And so my advice there is to find somebody that you can trust to have that conversation with. It could be a trusted religious advisor, your physician, it could be someone in your family. But the caveat there is just because if you're facing a procedure and you talk to your neighbor and they had that procedure, maybe they didn't have a great outcome, it doesn't mean you won't have a great outcome. It just means that you don't know the circumstances, and everyone's different. Everyone's care is different. There are different procedures that are involved. So don't necessarily be biased by somebody else's perspective.
And remember that family often has their own opinions about things, as much as they're the people that love you the most, but they're invested in your choices. So you need to have some people that you can rely on to be more objective and to help you process that decision making.
And oftentimes, we see this too, where you're in a good situation when you're talking about something, and whoever you're talking to and you're looking for advice, if they're asking you questions. Mm-hmm. Right? if they're asking you questions and trying to draw you to a decision of your own, you're probably in good hands.
Yes,
right?
Exactly. And said, "Oh, yes, you should do this."
Yeah. If they say I had that, and they go, well, you might want to.
Yeah, exactly.
So again, making that decision is itself a stress reliever, and so I think one of the things that we're seeing on the healthcare side, and certainly there's been an advancement, certainly orthopedics, where they help people get ready for surgery. So you might have heard the term prehab, where they do some work getting you ready. But there are other programs out there that are being developed, and that's where you really take, on the healthcare side, on the medical team side, you take a much more team approach. It's kind of a multidisciplinary and kind of an integrated team approach, where there may be an anesthesiologist, a surgeon, a geriatrician, all the people kind of coming together as a team to coordinate things on the healthcare side. And one of the things that really helps with that is some preoperative planning, having some discussions about, is this important to you? What are your goals? What are you trying to accomplish?
Exactly.
And so I think there was one study published in the Journal of American Medical Society and Surgery, and I have the reference a little bit later, where approximately 10% of people who went through that preoperative planning with the physician team and their family decided that surgery wasn't right for them. So going through that detailed discussion about what that surgery means to you may help you get through that decision about whether it's valid. But it's important to identify who has high risks for anesthesia. It's important to identify where strength and mobility work will help you. Reviewing medications that may be a problem after surgery or during surgery. There's some medications that you may need to come off of, and so having a real thorough review of the medications, and then anticipating what kind of pain you're going to be in afterwards, and for the staff to anticipate that there may be some mental changes, some what we call delirium afterwards, how to handle that.
Right.
So this integrated approach, we're going to see more and more of it, I think, because some of the preliminary studies show that taking that approach, what happens is that people generally, again, the benefits of doing that is that there are fewer complications. People are more likely to go home rather than to skilled nursing. Going back to the hospital afterwards for some kind of complications, and just fewer readmissions.
Right.
So those are the goals. Those are the benefits of taking this more team-based approach to getting people ready for surgery. So that's really on the healthcare side of things. And so I'm hoping that the programs like that get further developed, and that the medical teams really think about like that in a more multidisciplinary team approach. So what do you do on your side of things?
Here
we go. So you're not a passive bystander in this whole thing.
Right.
You're not just there on for the ride.
Right.
And you can help the surgeon and the anesthesiologist and the surgical team do their job by being an active participant in the process.
It makes such a difference to be engaged in the process and to feel in charge of your health and making this decision because it's best for you, and that you also are completely prepared physically, in the body, mentally, emotionally, and spiritually, so that you can really come out ahead, and here's how we do it.
Well, that's very much, if you think about it, it's why people have coaches, right? Or that's why you prepare for an event. You don't just necessarily put race day on the calendar and to just hope that you do well.
Yeah.
It's the same way to think about that, is what can you do to set yourself up for the best possible outcome? And so there are things, there's an active role that you can take. And again, we have seen that what happens when someone is engaged, is a participant in the process, involved in the decision making, and maybe we'll touch on that a little bit later, what that might look like in terms of the level of involvement. But now you're starting to get control back,
Right.
And that's the important part, because oftentimes the hesitancy, the ambivalence about doing the procedure at the core of that sometimes is fear of losing control.
Right.
So now this is the way you get some of that back. You start being an active participant.
And having made the decision yourself and understanding all of the parameters of what it's going to be like, when the pain or limitations occur is a normal part of post-op, you're aware of it, you're engaged, you have learned some skills to cope with it, and you're ready for it, rather than being totally blindsided by it all.
Right. And so you have those conversations about with your medical team, somebody else who's really been through it. There are oftentimes surgical coordinators who can answer some of your questions, but not to be afraid to ask them and to get involved. What is it going to be like when I come out of surgery? So you start anticipating what some of those things are. That lessens the fear, and again, it gives you a sense of control back. And so. What we focus on is there are three things that I think are really important that people can do, that we help people with, is to focus on the physical training that you can do ahead of surgery, to think about the nutrition as a part of the surgery itself. Right? These are all parts of the surgery. The surgeon is doing she's doing her part to make this, is successful, right? The anesthesia, they're doing their part, and what you do before is really part of that procedure, and that's a way to think about it.
Absolutely.
And so again, physical training, the nutrition piece, and then the stress management component. Those are the things that I'll emphasize.
Absolutely.
In working with the folks that we work with. So the physical training piece, I think the thing that I've helped clients with is to focus on some of the things that are going to be really important after you have surgery, because they're going to get you up right away. Mm-hmm. That's the thing today. It's so important to start moving. One of the complications after surgery, really for anybody, but particularly as we get older, is having a clot. And so those form in your lower legs, and so as soon as one of the things that decreases the risk of that is having you get up and moving early. And so part of moving early is being able to get out of bed, right? And so one of the things that I've seen and help clients with is really start targeting some exercises on and learning ways to roll on your side, slip your legs over the edge of the bed, use your elbow and kind of push yourself. So there's some tips and tricks on getting out of the bed, especially after abdominal surgery, that can help you, and physical therapists can help you. So I think the part we were talking about too is we talked about this tip before, and this it's the large muscles that make up your rear end, your seat. That gluteus maximus, you probably heard that term right before. That's the one that the 8-year-old boys laugh at when they hear it for the third time, right? But that muscle, that group of muscles, there's 3 of them. They help you get off the toilet. They help you get out of the chair. They help you step on a curb. They stabilize your pelvis when you walk. It's if you think about it, your one foot's off the ground at a time, so they help you stand when your foot's off. So that spending a little time working on those muscles before surgery can help.
Absolutely.
And there's 3 exercises that I'll share with you today that I've talked about before. And the first one is the big squeeze. And so I want you to try this when you can go back afterwards if you listen to this. But if you're standing at the kitchen counter, you kind of put your heels together. You just balance yourself. Really, you want to be holding on to something stable. And when your feet are the heels of your feet are together, squeeze those muscles in that make up your rear end. When we sit for a long time, those muscles tend to not be as active as they need to be. Mm-hmm. They also shut down. They also get quiet if you have knee pain, or lower back pain. The muscles in your rear end, partly as a protective mechanism, they go a little quiet. And so these are some tips to wake them up, so that you can again get off the toilet, get off the chair. Those are really important. So the big squeeze those glutes. The second one I talk about is it's called the bridge. And you might have done these before if you've had low back issues before, if you've worked with a physical therapist before, if you can get on the floor, you lay flat, feet together, knees together, arms out to your side, and you raise your pelvis up towards the ceiling. It's called the bridge. Mm-hmm. And one of the things I have been active at the Y before, and one of the things that I recommend if you don't have one of these at your Y or the gym that you go to, is to see about getting a therapy table, they call them, or a physical therapy table. They're just a couple feet off the ground, so that if you can't get to the floor, it makes it really easy to do these kinds of abdominal gluteal exercises.
For people that can't easily get to stand up or get low, that's wonderful.
Yeah, and if you've had knee surgery, if you had some other things, sometimes it's hard to get on the floor, and so what happens too is as those gluteal muscles get weak, our pelvis kind of shifts forward, and that changes our posture. And so we really want to kind of strengthen some of those muscles, and it makes it a little bit easier to stand tall. And again, that can help with the things that will be important after recovery. Yeah. And then the other exercise I talk about is the clamshell. So again, if you've done physical therapy before, maybe you've had some low back issues and you've gone through these and these are familiar with you, you can always pull up a video too. It's pretty easy to find them if you have access to the internet. But the clamshell, you lay on your side, knees up a little bit to your chest, feet and knees together, And your knees are bent maybe about 90 degrees, so they're pulled up a little bit on your side, if you can imagine. You can rest your head on a pillow, and then you separate your knees like a clamshell.
Just like
the
it
idea,
says.
just like it says. So three exercises. Kind of take a look at those. Talk to if you're going to be doing physical therapy. There may be some that you're going to talk to. If you have a trainer that you're working with at the Y, these are all ways that you can get somebody to help you build a program that can help. And sometimes, I'm a personal trainer, and so I work with clients doing that. But in the most recent case, I made a recommendation to actually get formal physical therapy because there's really some special situations there. So don't be afraid to ask your primary care physician for a physical therapy referral before surgery if you could use some help with balance, mobility, strength.
And these things, to initiate it preoperatively to strengthen your body, but they're going to help you forever, Yeah. So this is not something that's just short term.
Yeah. And I think if you're not having surgery, we talk about training for life. If you're not having surgery, these are great things to do just to keep that strength, so that if you find out 6 months from now you have surgery, you're in a better position. Mm-hmm. You're in a better position. So, any other comments on exercise? Huh?
Nope.
No. Well, it's hard sometimes. If you don't feel well, if you're heading for surgery, you may not feel well, and that's understandable. That's hard. But there are almost always there's ways to modify almost any exercise to accommodate your special needs, and that's why it's important at times to find a professional, a trainer, somebody who's comfortable working with older adults.
Yeah, and to remember that when you do these, they might be difficult and not your favorite thing to do at the beginning. But it will truly help you post-operatively. You'll be able to move around in bed and avoid the pain and have greater mobility and restore your life balance much quicker.
Yeah. And even sit to stand, sitting in a chair, making sure that you're secure, that you have some stability, and then just standing up from a chair, doing some of those can help.
Yep.
So, nutrition. That's we talked about. I think we last month, and this will probably get dated, so I'm not going to give the time. But we talked about brain health and nutrition and the importance of that. And
it was a wonderful conversation.
Yeah, it was really nice.
Yeah. To talk about the new way of thinking, of how you really clear your mind and create cell growth and expansion through the proper nutrition.
Right. It's we were also talking about your mom is usually right. Sometimes you don't find that out until you're until you're older, right? Yeah. Much later. But you are what you eat, and it really is true. There isn't anything more literal than that, really. Yeah. So the things that you take in affect all the chemical reactions, the types of the protein, the carbohydrates, the fats that you're taking in. Those get incorporated into your body, and so. Oftentimes in our Western diet, many of the things that we take in help contribute to this inflammatory environment in our bodies. That the some of the processed foods, the hydrogenated oils, the things that make things stay on the shelf for a long time and still kind of taste good after months sometimes. Those things, when we take those into our bodies, they can really help. They can set up a series of inflammatory processes or cascades where all sorts of chemical reactions happen, and then that can promote inflammation, joints. It can affect your cognition, sleep, so many different things. And so some of the foods and again, changing food behavior is really tough. I was telling Margie, I just kind of went through this 30-day challenge myself, and I eat pretty clean, but I went through a 30-day challenge and I realized how much coffee I was drinking. That was one of the benefits of doing that. Mm-hmm. And coffee has some beneficial properties, but when you drink too much. But periodically taking a look at what you're eating is important, and you do have a little time in that 4 to 6 weeks before surgery to make a big impact on by at least taking a look at some of the things that you're eating.
I always look at it as that everything that we eat is giving food to the body, but the body uses what's really good for it in a way that's very different than the processed foods and things. And you can either sit back and eat what you consider a normal diet and let your body struggle to get you healthy and to get recovered from surgery, or you can learn some new ways and really stimulate some positive chain reactions in your body and to really help it to heal on its own.
Yeah, Margie, you want to share some of the foods that can kind of set up this inflammatory process? I mean, people might have heard of some of these things, right?
Yeah, I think that a lot of us were raised on these kinds of diets, and kids certainly are introduced to these foods just even were at school. But really it's the refined carbohydrates, all of the white breads, and to me anything that's white flour or white sugar is really not healthy in the least. Fried foods, sugar sweetened beverages, sodas, and all the processed oils, the French fries and cheese curds and all of that. And there are many other foods that really do create that inflammation in us. And I'd rather than list the bad ones, talk about what's good, because that's what we really want. And to see the beautiful food on this list that you're going to talk about, because it's what our body craves. That's all there is to it. And you feel so much lighter and healthier and energetic when you eat these kinds of foods.
Yeah, and so if you're diabetic, these are conversations to have potentially with the dietitian as part of the medical team. But again, getting control of blood sugar before surgery lessens the risk of complications, right? So that's we both fully appreciate how hard behavior changes are with food.
Yeah.
Right. So I
struggle with that
a
lot. It's a very big emotional need. It's like comfort food.
Well, and when we were talking about brain health, I told Margie, when I was growing up, my mom timed the oatmeal raisin cookies to come out just as I was getting home from school. That's what it was like, right? So
nice mom.
My go-to for stress is oatmeal raisin cookies, because I learned that makes me feel good, or chocolate chip, or brownies. No, so I think we have this emotional connection to food, and we don't want to lose some of that, right? So I don't think this has to be a drastic change. Our message is even some small changes over time.
Yeah, and when you give yourself time is when you can really accomplish something. Because if someone suddenly tells you to eat like this for your medical condition, that's really tough, But if you can take months and years to slowly get used to it and value these beautiful foods and how you feel, then when you eat one of those old comfort foods too much, you realize, I don't feel as good. Why would I want to do that?
Yeah, so if you're watching and you don't have a surgery coming up, but just think about what you're having, because that might be coming down the road, and making some wholesale big changes are really difficult. But I did my residency. Part of my time was at Bellevue Hospital in New York City, and there was a big sign when you came in there that said that the decisions that you make every day largely determine your health. And it's the little decisions, right? What you're eating, and it's never too late to make some changes. So substitute one of the things that we talked about with something else, and not necessarily make some huge radical changes. Right. So the kinds of things that have been shown to be anti-inflammatory, really help decrease inflammation. It was like the fatty fish, like salmon, mackerel, tuna. I actually made what would be like tuna fish with sardines. And so that's a new one for me. I tried it.
Good for you.
Yeah, I tried it. I have to say I tried. But fruits, like all the berries. One of the things about being up in Door County is that the strawberry season will be coming. I've got a blueberry farm close to where I live. The cherries are out, so the berries are fantastic. Lots of antioxidants. They have a low glycemic load, so they can help regulate blood sugar. So berries are great. Fresh vegetables, particularly like tomatoes, peppers, a lot of colorful things generally are good. Olive oil, avocado oil, some of the oils better than highly processed oils. Green leafy vegetables. Again, Mom was right about the spinach. She didn't know. I don't remember her ever talking about kale. That's a new one, right?
Yeah, it's new.
We didn't make kale chips when I was growing up, but leafy green vegetables loaded with magnesium, and it's one of the things that many people are deficient in. And magnesium is critical to so many enzymatic reactions. That getting magnesium is really important. It affects sleep. muscle function, all sorts of things.
It also has calcium in it, all those, and that's wonderful for osteoporosis and that.
Yeah. So maybe some of these are a little new to you, and I've tried out some recipes. I made this, lots of onions. They actually came from my garden, and you saute those really nicely in olive oil until they get really nice and sweet, and then you throw the kale in there with some vegetable broth, put the lid on, finish it with some walnuts, shredded coconut. I mean, there's ways that you can make these things taste great. And so it's just being curious and really, again, being active and take control of what's going in.
Yeah.
Almonds, replace some of your potato chip snacks,
Right.
some of the other things with almonds, walnuts, those kinds of stuff. So again, the nutrition piece, again, not necessarily saying do all this at once,
Right.
but colorful things, again, like carrots, avocado, berries, kiwi, greens, a great thing to add.
And you have a picture here of your breakfast.
That is my breakfast.
Yeah.
I throw that in a blender,
Yeah.
and it is it's just a routine, it's a habit. It's just gotten to be part of my regular.
And for people that don't particularly like those individually, that's a wonderful way to make a delicious way to take them in. So
Yeah, you can hide stuff in
Yeah.
there, right?
I do not like kale, but I can freeze it and put it into a smoothie, and it's just there,
Yeah, someone when I was listening to the trainer podcast, and he hides things in for his kids. They don't even know what's in there, which is a way
Yes.
to get. And a thing about blending smoothies and things like that is you can get a lot packed into a. And this is where protein shakes might be helpful ahead of time with surgery. Again, talk to the dietitian on your team and find out.
And again, to eat something like that in the morning in place of cereals and toast and all those heavy carbs. Not to say you have to do it every day, but the more that you can put a healthy breakfast like that in you to start the day it's going to decrease inflammation and really restore cellular health too.
So instead of again, part of this is habit, part of this is what we are used to, part of this is what we're comfortable with, but a sugary breakfast cereal, is what we're accustomed to. But that's where you may feel the energy, you may feel that ebb in energy later in the morning. You get that sugar rush, that spike, and then you pay for that a little bit later.
Yeah.
So I think one of our messages today too is that I find that there's a lot of kind of confusing information out there on nutrition. Right? You hear about all these different diets.
Absolutely. They're fad diets usually, and to really get the one that's correct for you and has some sound science behind it and that you can live with. It can be a new way to eat rather than to lose weight or to achieve a goal.
Yeah, so I find, for me to try to decrease some of the noise and really just to go to a site that I trust. Cleveland Clinic, Mayo Clinic, Harvard the Harvard website. There's some good information on some sites. Find one that you can trust. So ask your physician. Ask someone that's into this. Your trainers, physical trainers, personal trainers are often or may have some sites that they can recommend. But the three I want to mention today that you may have already heard about, or if you want to do some research on, is a Mediterranean diet. Some of the picture that I showed, there were things we talked about: olive oil, tomatoes, those kinds of things, vegetables, the Mediterranean diet, fish.
Some of the sour things, the olives and artichokes and things like that.
Yeah, so the Mediterranean diet. The other one is the DASH diet. That stands for the diet intervention to stop hypertension. Is really reducing salt in the diet. Getting hypertension under control before surgery is really, really important. And again, longer term. So the surgery is you're just heading into surgery. Perhaps there's the recovery afterwards, and what kind of changes can you make that go on after that. So the DASH diet is out there, and then the MIND diet was developed. And again, these acronyms sometimes can be a little bit confusing, but you think of the MIND diet, which stands for it's really the Mediterranean DASH intervention for neurodegenerative delay. That's what that stands for. That's what MIND stands for. And it's the Mediterranean diet and the DASH diet kind of brought together. And that one really is focusing on cognitive health, because we are seeing that there are some dietary interventions that can help with cognitive function, with brain function. And so, take a look at Google Mediterranean diet. There's lots of cookbooks, there's a lot of information out there on the MIND diet, DASH diet, Mediterranean.
And I think people are getting pretty savvy. I bet if you start talking to some of your friends about these things, you'll find out they eat that way too,
Yeah, you can pass the dish, right?
Yeah.
So finally, I think the thing that Margie and I both really enjoy talking about, coaching individuals through, is the stress management component. And that could be focused on the period leading up to surgery, but some of the skills that you can learn to help better manage stress are applicable for the post-operative period, when you're trying to deal with the pain, maybe the post-operative pain. To practice some of those skills can help with the pain management piece. And so there are other techniques besides one I'm going to share with you today. Margie's very interested in expressive writing as a tool, and ways to address the fear. There may be anger. There's all sorts of emotions associated with some of these things. And using expressive writing is just another way to tackle that.
Absolutely.
To help manage the emotional component.
And the stress management, not only will you feel more balanced and more engaged, but it really truly does decrease the physiologic stress in your body, so that you're not using all the chemicals and the neurotransmitters in that way. Yeah.
So if you've done mindfulness meditation, or if you've done yoga, or if you've done any Tai Chi, prayer, there's a lot of techniques or things that you might be familiar with. This could be completely new to you, depending on what your background is, what your experience is. But there are techniques that you can use that will slow your heart rate, lower your blood pressure, and shift you away from that stressful environment in your body. Decrease the cortisol, which long term has bad effects. That's where chronic stress increases the wear and tear on your body. Those chronic stressful situations accelerate heart disease, makes it harder to manage diabetes, robs your bones of minerals. There's so many things from being in a chronic stressful environment that long term are really detrimental on your health. And they even make it harder to eat well. I mean, stress, not managing with the stress, makes it harder to get to the gym. It makes it harder to pick the right foods that you want to eat. In some ways, that's why I think stress management, mindfulness stress reduction, is a keystone habit that you put at the foundation of the things that you're trying to do to improve your life. And I have found personally that everything else flows easier when I manage the stress.
All those changes then become stressful, instead of starting with this first and feeling engaged and in charge of things, emotionally.
Yeah. So I start with the stress management piece first, because it makes everything, it makes everything else easier when you come from a place where you have more coherence, where you're better balanced. And so you said, Dr. Dave, that's easy to say. Well, how do you do that, right? So what I'm going to just sort of spend the rest of our time here talking a little bit about some techniques to help you get started. And we could go on for quite some time, but I think you might have heard that there are some breathing techniques, and if you haven't, if you've had small children, or you've ever been told when you were a small child to take a deep breath, I think you'll understand. I mean, that's oftentimes, and when you see a child that's upset, they're like, how do they breathe when they? Oh. It's rapid.
It's rapid and short,
and they can't even catch their breath,
in the
right?
face, and
it's rapid and it's irregular. And one of the things I think parents often do is just try to get them to breathe, take a deep breath, slow the breathing down, and it works.
It does work. And it works on the older people even better, because kids are resilient, they'll come out of it. But for us adults, we really need to practice this, because the shorter breathing has become our habit, through adulthood.
And the other thing, kids they haven't developed the ruts or the patterns of responding to stress. So the rumination, the worry, some of those things come later as we repeat that pattern over and over again. So the very first step of when you're feeling anxious or stressful, and you can apply it to the surgery. Just even looking at that data on the calendar may trigger that sense, that more rapid heartbeat, the worry, or when you think about that decision, is really to take control of your breath and think about your breathing. Some deep breaths, slow your breathing down.
Feels so good.
Yeah, 5 seconds in, 5 seconds out. So afterwards, if you practice this, I think you'll feel the difference. And in the beginning, again, you can't walk around breathing like that all the time, right? So, but the idea is say your surgery is 4 or 6 weeks out. First thing in the morning, before you even get out of bed, take 5 minutes to practice this slower, deeper breathing, and then do it before you go to bed at night. And start building up again a habit of using this technique. And the breathing is I call it the portal, the entryway to the techniques that follow. That we'll share a little bit with you. But again, I want to mention, if you're interested in learning more about these techniques are this whole package of techniques pioneered by HeartMath. There's information available at heartmath.org. I'm a certified HeartMath practitioner as well, and so these are techniques that
my program is deep and long and wonderful. So.
There's tons of different applications and a lot of different techniques, but for today, what I really wanted to just make you aware is just how powerful taking control of your breath can be in a situation where you're anxious and you're worried. But the easiest way to start this is develop this habit when again, in the morning and in the evening, and maybe just 5 minutes, and then slowly start adding extra time during your day, maybe over lunch, or start building it into your day at regular times, so that when you need it, when you're really fearful, you're stressed out, when you're in pain, you have started to restructure your brain. And that's what's amazing. Your brain starts growing new pathways, develops these kind of a new network in terms of how you're going to handle stress. And so the first step is to take some deep breaths. Deep breath in, and then exhale. A 4 or 5 count is what works well. And then that's just the entry part.
And I always think too, for me, I've been doing deep breathing for a long time, but I realized that I wasn't necessarily exhaling for 5. And to really empty out your lungs, that's the other really healthy part, to shift those neurotransmitters.
Yeah. And I think I read a study that individuals who sing, I'm not a singer, but don't ask me to either. But part of that diaphragmatic control, taking care of your breath, some of the same physiologic benefits of this technique of mindfulness stress reduction using breathing are seen in people who sing, because that kind of breath work can help. There's information that your heart sends to your brain that tells your brain essentially that things are okay. That's a simplified way to put it, but that's kind of how it works. Now your brain says, okay, maybe
I can relax.
Things aren't as bad as I think.
Right.
My heart's telling me.
Your whole body relaxes.
Yeah. But so again, you can't walk around breathing like that forever. So the breathing part is just the portal into the second step, which is to regenerate a feeling, a positive emotion. And so this isn't our problem with fear, losing control. It's not a thinking problem, right? It's an emotional response. So the second step is to recall and to regenerate the feeling of appreciation and gratitude for someone, something, some place that you have. So it could be the healthcare team you have. Absolutely. It could be the caregivers you have. It could be the great medical facilities we have around here. It could be whatever, a relative. It could be long past, somebody who guided you, somebody who's a mentor. There's all sorts of, it's a very deep well you can go to, right?
Oh yeah, once you get started.
Yeah, once you get started, it's amazing what you can start.
Yeah.
What you can start feeling in terms of regenerating these positive restorative emotions like joy, gratitude, appreciation, love, companionship. Those are the restorative emotions that will alter things. And then finally, step 3 is once you get to that place where you feel that appreciation for someone or something, pet, grandchildren, whatever. Then the step 3 is to breathe in with that breath. Breathe in an attitude of calmness, courage. We were talking about that in our writing workshop, right? Yeah. The underappreciated emotion or underappreciated feeling of courage. You've been through some tough things before, or you know some
Facing
people.
surgery, it takes courage.
You know some people probably who have been incredibly courageous and gotten through things. Think about them, how they did it. You can bear it, and to replace that feeling of fear, anxiousness, irritability, frustration. Replace that with an attitude of what we talked about. Yeah. Replace an attitude as you breathe in, and this whole process could take you, 5 minutes. It doesn't take long. You can do it anywhere. You don't.
Standing in the grocery line or anywhere else, at a red light.
Yeah. For me this morning, it was when I had to reboot my laptop in the middle of a webinar. So you can use this at any time, any place you want. You can use this as you're heading into surgery. You can use this when you're heading into physical therapy after surgery. Right. There's so many opportunities to do this, and it's independent of anything else around you. You don't need to go someplace. Right. You could be,
you need nobody's help other than practicing it and getting used to it. Yeah. And you can use it constantly.
So again, we just touched on the surface, I guess. I just wanted to, it's a deep topic that you could go into for quite a bit. But I just wanted to share the importance of that piece, that the underappreciated part of the stress management piece.
Yeah, and that is really the overarching blanket for it all, to get a hold of your stress and to help with it. And everything else falls into place then. Yeah.
So now going back to the beginning when we were talking about this, the difficulty that you might be faced with the decision.
Yeah.
What happens if you practice this technique? You sit down, quiet spot, initiate the deep, slow breathing, and initiate a regenerative feeling of appreciation and gratitude, and then replace a feeling of fear or worry or concern with a feeling of confidence, courage, and then tackle the problem.
Right. Don't be focused. Yeah, you're not focusing on solving the problem. You're focusing on changing your attitude.
Because what happens is when you do that, the decision making part of our brain, the chief executive officer or executive function, the part of our brain that helps us solve problems, make decisions, goes offline when we're afraid.
Yeah, it does.
Or when we're frustrated or anxious. I had a hard time finding the restart on the computer this morning. So, but it's true. You can't find your car keys when you're upset, right? Yeah. Or you're in a hurry, or you're late. You don't know where you put your wallet. I mean, though it's because our decision-making ability is impaired when we're frustrated, angry, irritated, afraid. Yeah. And so if you start from a place of coherence where you're better balanced, where you've eliminated some of that stress response, you'll be amazed at what kind of insight can come, what kind of problem-solving abilities are unleashed and opened.
Absolutely.
And then get your shoes on and go to the gym.
Right.
Or
first make that smoothie.
Yeah, or eat something that's a little bit better for you. So, I think that's our message for today. Yeah. And so I really appreciate the opportunity to be here. And again, I'm Dr. Dave Ferguson with IKOR Midwest. We offer Lifecare planning and Lifecare management services. And
Marggie Hatala, nurse advocate and life doula.
Thanks, Marggie.
Thank you.
Appreciate it.
Hi, I'm Carolyn Stark with the Carolyn Stark Real Estate Team with Berkshire Hathaway. I just want to say thank you to Dr. Dave and Marggie for joining us today, and what a great presentation it was. Also want to thank all of you for joining us.